Hi there. So there's been another death in a Canadian ER. It happened over the holidays, and that is one of many that have been happening now in the last few months. And so I wanted to do a video on how there's so many things coming together now and the breakdown of so many systems. And a lot of people aren't seeing and they're not connecting the dots. So I thought I would just get on here and talk a little bit about the healthcare system and also the housing crisis and the financial crisis and how things are working together basically to form a new type of government, a new system, and it is called the New World Order. And so if you look at when you bring in a new system, what do you have to do if there's an existing one that's already present? If you think about that logically, what you would have to do is break down the older system, bring it to its knees, and then bring in your new system. So I believe that is what is happening right now. If you look at the situation in the medical system, especially in Canada, Canada is really leading this right now. I'm in Canada, and I'm finding it just it's mind-boggling what is happening as far as not only that people are dying in ERs, but yet at the same time we have this MAiD, this medical assistance in dying, changing. And boy, is it really changing. Now, I'm a nurse. I was a nurse for 20 years, and I was a geriatric nurse. And so in 2016, I think it was around 2016, 2015, 16, they brought medical assistance in dying in, basically, in Canada. And I remember I went to the conference about it and the whole thing. And at that point, it was more along the lines of palliative care. It was someone with a death date, someone that knew they were going to die, but were suffering. And at that point, it led them to, since they were suffering and they had an end date to dying anyway, it allowed them to put in a request to basically be euthanized a little bit ahead of their time to save the suffering. And that's what it was put in place for. Now, I remember at this conference that we were at, there was a doctor. Of course, I was there with doctors and nurses. And one of the physicians that was a Christian just said he wasn't doing it. He said, no way. So I often think about him and I wonder, what is he saying now? So if you look at our medical system right now, it is literally breaking down in front of our eyes. We have people dying in ERs. We have the Canadian government saying, hey, it's not only that can you access MAiD now. If you're dying, you have an end date to life, you're suffering physically, you're going to die anyway, but your suffering will ease your suffering a little earlier. That is no longer the purpose of MAiD. The purpose of MAiD now can encompass many issues. And so now you get mental health disorders. Now you get people that with depression. Now you get people, and this is what's really interesting, and this is what's really evil. You get people now that are having a hard time affording life. We have everything is going up, 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 up. Everything, inflation, right? Like, really, since C19, there has been a breakdown of food chains. There's been breakdowns of all of the things that we need, right? So now you're going to start seeing things, just regular things that you use, going, I need to sustain you, milk, bread, the whole thing. They're going to keep going up, 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 and up. So at the same time you have the cost of living and groceries going up, you also have the housing crisis, and you have people now that were used to pay, they were used to paying for a 2-bedroom apartment, maybe $1,000 a month. Now we're seeing it almost doubled, $1,800 to $2,000 a month, just for a 2 or 3-bedroom apartment, right? Not to mention the mortgages on houses now. I know when we had bought our house way back in 2004, we paid I think it was 199 for it or something like that. 199,000. We sold it for 270, and that was that was back in like 2017. But then that's great if you're going to, sell your house, but you got to buy another one. And now houses are doubled and tripled in prices, right? Like houses that were going for $200,000 are now $400,000 to $500,000. So I'm going to pin a few things in my description box after I'm done this video, because I have found some very, very interesting documentaries. And one of them was, I think CBC did it. And it's talking about the housing crisis. And it's talking about how these people, if you're locked in, this was in the perspective from Ontario. So if you're locked into, if you've been in a lease forever, they can only raise your rent prices up so high. But if you leave and they have that same unit, they can, even though, someone staying there would only be paying $1,000 a month, and they can only raise it like 5% each year, whatever inflation is. You get someone coming into that apartment, fresh and new, they're now going to be paying $1,800 to $2,000 a month just to live. And that's just your rent. I mean, that's not electric's going up, your gas is going up. Obviously, we just talked about groceries. Groceries are going up huge. And so, if you look at that, and then you look at what Canada is bringing in at the same time, this MAiD, it really makes you wonder, right? Like, the timing of all of this just seems to be perfect for people deciding to do certain things that maybe the government are trying to get them to do, right? So there was another interesting documentary I watched on the housing crisis, but it wasn't it wasn't on the housing crisis. It was actually on MAiD, the doctor-assisted suicide. And so this documentary that I watched had it from this perspective of disabled people. And I could not believe my ears when I listened to it. I basically heard people that were disabled basically saying, no, I don't want to die, but because I'm disabled and because everything costs me so much and I can't get, the money that I need, that I am now considering applying to be suicided. And this is the mentality. This is where it's going, people. This is where it's going. And so when you look at, with the cost of living, everything going up, you've got these people that are disabled and they just can't afford to make their rent. It is as easy now, and if you watch this documentary that I'm going to pin up, it is as easy now as getting online and finding yourself a doctor online on their website, explaining a few little things to him or her about why you can't be here anymore, you need to check out, and that doctor will approve it. So it's like a suicide hotline. And what it reminds me of, this whole system and this whole, government, the call center, the suicide hotline kind of thing, it reminds me of, I've heard people talk about, back when they used to get marijuana online. It's like that simple. There's a doctor on there and you just simply tell him what your issue is and he approves it, kind of, right? I could not believe it. Like, this is right in this Canadian documentary, and it gives you the number on the documentary. It's showing everybody the number. So simple. And so a lot of people might look at this and look at me talking and say, oh, well, really, like, are they really trying to give you that whole impression that if you can't afford to live, to off yourself? Yeah, that's exactly what they're doing. You can say they're not doing that or whatever, but that is exactly what they are trying to put in people's heads. This is exactly the way this is going. And so if you look at these systems, you've got kind of your medical system and your financial system. They're kind of just, really teetering here on just, on a fine line. I mean, you don't only have people dying in ERs and going for doctor-assisted suicide in Canada, you also have really poor care in these hospitals when you're in them. My mother was in the hospital for surgery a while back, and it was this fairly simple surgery, but she basically didn't get basic care in there. I mean, just things that you would need done. I mean, commodes that need emptied, just basic service, basic, ring your bell and a nurse should show up and dump your commode before you eat breakfast or put it out of the way. No, they weren't doing any of that. Because of COVID, everything changed. They weren't allowed to dump commodes. It was just, I could not believe, as a nurse that used to work in a hospital at one point, I could not believe the things and she's not one to embellish. She's not one to embellish. She doesn't even realize what's going on as far as, the healthcare system. But she really didn't get the care that I couldn't believe it. I really could not believe it. And so she's just one story. I mean, you have these people that are literally in ERs that are dying. You have, people, and see, where this started, you can say, no, it didn't, or whatever. But if you really look at it logically, the breakdown of all these systems happened when C-19 come in. And so, like I've said before, C-19 was the beginning of the breakdown of these systems. And so why are they, if they're doing this, why are they doing it? Why are they doing it systematically, right? So that would be the question to a lot of people. Why would they do this systematically? Well, like I said, if you want to bring in a new system, you're going to have to break down and tear down the old one. So it all stems from them wanting to bring in what is called the New World Order. Now, you have heard presidents mention this. There is not anybody, I'm sure, that has not heard this term, New World Order. And like I have said before, if you turn to your Bibles in Revelation 13 and you read that entire chapter, it talks about a one world governmental system that the Antichrist will be the head of, right? They have to get to that system somehow. I mean, with C-19, they've taken it farther than they ever could have. They really do. And they are still propelling it forward. So that was the beginning of the end of these systems, I totally believe. So you get the Great Reset, which is just the whole... C-19 was the scapegoat for that. We can now say, okay, we had to take down, financial things just happened, right? Like people couldn't go to work. There was all these firms that got the virus, all that kind of stuff, right? Stuff that couldn't be helped. And now our solution is the Great Reset. We're going to bring in a new financial system. But at the same time, we're going to bring in a new medical system. We're going to bring in a whole new system, and we're going to call it the New World Order. And so if you look at all this, if you look at MAiD, if you look at the situation in the hospitals, if you look at everything with spiritual eyes, connecting dots, you will see that they are now tearing all those systems down, and they're about to rebuild. And so when you look at MAiD and you think, what is going on, Canada? What are you doing? Do not think if you're in another country that you will not be next. It is not just going to happen in Canada. This is worldwide. The whole system is a new world order. So if it's not affecting you now, it will be. And if you don't see it now, you will. Anyway, that's all I had to say on the matter. I hope that if you did make it to the end of the video, that you could hit the subscribe, like, and bell notifications. That would be awesome, and I'll see you on the next video. Bye-bye.